So welcome and thank you for joining us this afternoon for Streets Heaver's webinar on GDPR and how Compucare will assist you in being GDPR compliant and what steps we are taking as a company to ensure that we are ready for the new legislation. My name's Imogen Dawson, the account manager at Streets Heaver, and I will be running the webinar for you today. So we just have a disclaimer visible on the screen for you now. So if you can have a quick read through this before we get started. Perfect. So while you're reading through the disclaimer, I'll quickly cover the plan for any questions that you may have. If you have any questions during the webinar, you can add them to the question box available, and we will answer these either during the webinar with written responses, or they will be answered in the Q&A session at the end, where my colleagues Stuart Heimers, Benedict Heaver and David Skinner will also be joining me. Before we get started, I will quickly run through the agenda for today's webinar and what topics we'll also be covering. Firstly, I will give a quick overview of GDPR and then what we have developed in Compucare to assist you with your compliance. I will first start off with the Compucare 7 system and then I will move on to the Compucare 8 system. After that, I will cover what Streets Heaver as a company are doing to ensure that we are compliant, and then we'll finish things off with a Q&A session at the end. Hopefully this won't take any longer than an hour. However, if there are any questions that we are not able to answer in time, I will respond to these after the webinar. So what is GDPR? GDPR is the new EU General Data Protection Regulation and will be coming into force on the 25th of May 2018. This will include the UK regardless of its decision to leave the EU and will impact every organisation which holds or processes personal data or sensitive personal data. It will introduce new responsibilities, including the need to demonstrate compliance, a more stringent enforcement, and substantially increase penalties of the current Data Protection Act. Those penalties can be fines of up to €20 million or 4% of global turnover, as well as compensation claims for damages suffered, reputational damage, and also loss of trust. Another key change of GDPR is that the processor of the information can be just as liable as the controller. Before, it was the controller who was responsible for the safety of the data. So, for example, if you host your system with a data center, both yourself and the data center are now responsible, whereas before it have only been you. You will have to be GDPR compliant if you process any personal information of anyone in the EU, regardless of where the data is held. This is another key change. Before, you could abide by the laws of the country the data was stored in. Now, it is about the individuals you hold the data on. There are two main areas of GDPR that Compucare will be able to assist you in. They are the right to erasure and the right of data portability. So firstly, I'll start off with right to erasure, also known as right to be forgotten. Under GDPR Article 17, it states that individuals have the right to have their personal data erased. Any requests can be submitted either verbally or in writing, and you have 1 month to respond to the request. This is a legal obligation to comply. This right, however, is not absolute and will only apply in certain circumstances. It is the responsibility of the owner of the information to consider if the data should be removed. While the new regulations enable individuals' right to be forgotten, there are standard retention periods that will overrule GDPR regulations. For example, those governing health records and employee records. These can be visible on the screen. Clickable versions of these links are available within the webinar description. So now I'll move on to right of data portability. The right of data portability allows individuals to obtain and reuse their personal data for their own purposes. It will apply to the following, which can now be seen on screen. Personal data that an individual has provided, where there has been consent from the individual or the performance of a contract, where it has been carried out by an automated means. The information needs to be in a structured, commonly used, machine-readable format. For example, CSV files, which is what we were using in Compucare. If an individual requests their data, you must respond without undue delay within 1 month. If the request is not going to be processed, the individual needs to be informed why. You are also not able to charge the individual a fee for exporting their data. More information can be found at the ICO website following the link now on screen. Now we've had a quick overview of GDPR and the regulations Compucare will be able to assist you with. Let's move on to Compucare 7 and then followed up by Compucare 8. So, the latest upcoming release of Compucare 7, which will be 7.26, will have all of the GDPR features in that I'm just about to cover. We expect that 7.26 will be released at the end of this month. Starting off with Right to be Forgotten. All of the standard retention periods will have been already preloaded into the Compucare system as a part of the 7.26 upgrade. With the use of the retention periods, Compucare will automatically identify patients that should be considered for anonymisation. To identify which patients need to be considered for anonymisation, as a user-initiated task, you will be able to export a CSV file which details the list of patients that should be then considered. The export will provide a list of 500 patients at a time, which you will need to review these first 500, then move on to the next set. Once the list has been exported, you will need to review all of the patients and identify those that require to be anonymised. The patients identified for anonymisation will need to be done individually. This can be done by searching for the patient, then selecting the option within the EPR to anonymise the record. Once you've gone through the anonymisation process, the patient's record will now have been hashed out. Compucare will do the combination of deleting and hashing out data depending on the record type. Once a patient has been anonymised, a stub record entry is automatically created for auditing purposes. When a patient has been anonymised, it is not reversible. We appreciate that for those customers with many years' worth of Compucare 7 data, that running of the report and the manual process of anonymisation may take some time. At a customer's individual request, our support department have the ability to help produce the initial reports of data and the subsequent batch anonymisation. A small fee may apply for this work in order to cover the costs of assisting with these processes, as it is outside of the normal remit of our support and maintenance contract. Moving on to right for data portability. Similar to the right to be forgotten, the system is automatically loaded with the standard export files that are required in relation to data portability. The ability to export the files is located under the patient record. This will export the relevant files in a CSV format so they can be saved to a portable device for the patient to take away. Now we've covered Compucare 7, I'll move on to how Compucare 8 will assist with GDPR. You will need to be on the latest version of Compucare 8 for the GDPR features, which is 8.9. This has already been released and is available to download. Compucare 8 essentially has the same GDPR functionality as Compucare 7. However, Compucare 8 is a lot more user-friendly and allows for site-specific configuration. I will first start off with the right to be forgotten. We have created a patient record retention app that can be searched by its full name or using GDPR. This can also be pinned as a tile to your home screen. This screen will show you all of the patients that have been flagged for anonymisation that will require reviewing. The system follows all of the preset retention rules and will automatically generate this list. This will run through the service once a month and is configurable. Once you have reviewed the list of patients and identified those that require anonymisation, the next step can be done in one of two ways. Option 1 is using the patient record retention screen, where you are able to individually anonymise a patient as well as use the multi-select to anonymise more than one patient at a time. Option 2 is to go via the patient area. There is an anonymised data app which when selected will pop up with a warning to double check that you're wanting to anonymise the patient. If happy to do so, you can then click the anonymise button. The system will also check validity before proceeding, in case the patient has booked another appointment since you began this process. As you can see, once I have anonymised the record, this is what is left visible to the user. All of the patient identifiable data has been hashed, including any notes, fields and forms which would have been deleted. A stub record of who the patient was is left in for auditing purposes. This audit can be viewed by those who have the required security profiles. Now moving on to right of data portability. Similar to Compucare 7, the system is automatically loaded with standard export files that are required in relation to data portability. The ability to export files is located within the patient area by searching for export patient. The app will allow you to export the patient's data. It can also be pinned to the patient area if required. When selecting Export Patient, you will be presented with the option of where to save the CSV files. One of the significant differences in Compucare 8 is the ability of configuration. The Compucare 8 service will run monthly to identify patients that require to be reviewed for anonymisation. The configuration is all stored in the global settings. Then if you move down to the patient settings, this will show the GDPR configuration. So if we start at the top on the right hand side, you are able to schedule the preferred date of the month and time for when the Compucare service will run. Then below this are the default retention periods as stated by HMRC and the NHS, which we mentioned earlier in the webinar. The site's preferences can then be edited if you wish to hold the data for longer. The specialties can also be added for dental, maternity and mental health, as these will affect retention periods for those particular specialties. Below this is all the export files for data portability. While these are standard export files, additional export files can be added if required. Now I have covered what the Compucare systems will be doing to assist you with GDPR, I am going to cover what Heaver has been doing as a company. We have always taken data security very seriously and put it at the heart of everything that we do. This is apparent in our continued certification of both ISO 27001 and the Information Governance Statement of Compliance. We continually re-evaluate our security arrangements and look to automate processes wherever possible. An example of this is that we have recently implemented 2 class-leading next-generation firewalls, as well as security products from Microsoft to give us the best-of-breed solution for both intrusion prevention and network security. This, along with automation of tasks such as patch management, helps to protect us from attacks such as WannaCry. We are also investing in third parties to validate our own applications as well as tools to continually check for vulnerabilities. Our annual staff training has also been updated, and all of our staff have recently undergone new information security training to prepare for the changes GDPR has introduced. This has enabled us to overlay the requirements of GDPR onto our existing policies and procedures. We have invested in new systems to produce data flows and have spent the last few months mapping the whole of our business and the information flow around it, as well as individual systems. From these data maps, we are assessing whether a full data protection impact analysis is required. Heaver have been working closely with a third party on the production of this template and the criteria required. Between the data flows and the DPIAs, we can ensure that these have, firstly, thought about the data flowing in, around, and out of the company, and secondly, assess the risk of this information and either removed or reduced the risks as far as possible. Further investment has also been made in an IT governance GDPR toolkit, which we are using to re-evaluate our policies and procedures with GDPR in mind. We have also taken steps to ensure that all third parties we use are conforming with GDPR and applying its principles to their business. The organisation has included GDPR in the Q&A department's remit, who will continue to ensure the importance of information security within the business and ensure regular audits of all processes are carried out and any findings are implemented in a timely manner. With the Q&A manager being at point of contact in case any security incidents should occur and to liaise with the ICO and customers on any matters. Now looking at the website, we are updating our website to provide a guide to end users on what data we collect and how it is stored. The website will also hold our statement of compliance. Now, finishing off with contracts, to abide by the GDPR regulations, there is an addendum to your Compucare contract. To request this addendum, please contact compliance@streets-heaver.com. The addendum will need to be signed by both your organisation and Heaver. Take a look on screen now for some useful links regarding GDPR. Clickable versions of these links are available within the webinar description. Lovely. So that then now leads us on to the Q&A session. So we have approximately about 20 minutes to cover any questions that you may have. If we aren't able to answer all of your questions in time, we'll respond to you after the webinar, and I'll also send out all of the questions and answers as well for you so you can review these at a later date. Okay, lovely. So we've just got one through from Maria.
Patients will need to sign a consent form that they will allow their family doctor to receive results. How is Compucare handling this?
At the moment, that would be a process looking at the registration form documentation. I think there's probably a whole piece around consent that we need to get onto with regards to Compucare, but for now, sort of the initialing and signature against the different forms of consent that might be needed will likely be done through changes to the outpatient and inpatient registration forms. I think going forward, we already have our own patient portal. One of the principles within GDPR is that you're supposed to be able to give your consent but withdraw your consent as easily. And so I think actually what we'll be looking at is that consent model moving online to our patient portal so that patients can opt in and out of, in this case, submission of their discharge summaries and results back to their GP, but in other cases, subscription to SMS or marketing and things like that. I think because it's going to be so wide and varied as to what our customers are going to be looking to do in terms of their consent, we're looking to use some of our forms technology to allow customers to configure and ask their own different pieces of consent or items of consent that can then be made visible through that portal. So at the moment, to answer the question, it would be changes to the registration form, and then they could be scanned and attached into the patient file of Compucare. And that would work for both versions 7 and 8. I think going forward in version 8 and that piece around the patient portal, that's where we would then look at that consent model in more detail as to how that could be structured.
Perfect, thanks for that, Stuart. So hopefully, Maria, that's answered your question. If not, feel free to ask another one. If anyone else has got any more that we can answer a few more of those. Okay, yeah, we just got another one. So after the retention period, do all patients have to be anonymised? David, did you want to take a whack at that one for us?
Hi, yeah. Basically, the retention periods are set in Compucare and for the general patients, but there may be reasons that that you can't anonymize them. So there might be some legal requirement, some public interest requirement. So each individual would have to be based on their own merits, really. So obviously between the different systems, there are the options to choose who you want to anonymize, and that's in 7 and 8. So it's sort of down to an individual case and based on their details. But the majority sort of conform to the retention periods that has been set.
Perfect, thanks for that, David. Lovely. Oh, yep, we've got another one. So we've got Maria's asking how long is the retention periods? Yeah, I think Stuart's going to take that one for us.
I think fundamentally there are lots of different pieces of data that Compucare is storing. So the easiest one to look at initially is around the billing information. So there are HMRC guidelines around how long that information needs to be retained for within your business. So Compucare will be looking at each patient record and what the last financial transactions were on those records to essentially ensure that they're older than 7 years. So the current HMRC guidance is that you need to keep them for 6+1. So essentially making sure that the last tax year is catered for within that. In terms of the sort of more administrative data away from the finance data, so the appointments, the notes, the activity that you're recording within Compucare, there are different retention periods. So for adults, it is 8 years generally, sort of as the basic one, in terms of if you haven't seen a patient in the last 8 years, you should be considering whether you still need to retain that record or not. In terms, it differs a little bit when it comes to the records of children. So you would have, if the patient was treated at all as a child, it would be sort of 18 plus 7, which would take them to 25. But if they were treated at age 17, they've got to keep the record until they were 26, and things like that. And then actually, when we've decided to follow the NHS advised retention periods, as that just made sense to us, really. Although, as we've said in Compucare 8, you have the ability to be able to set your own retention periods, but the NHS ones start to stipulate by specialty how long different patient records should be kept for. So we've currently looked at the episode of care, so that referral information coming in. We've looked at the specialty that's been recorded against the episode of care, so whether it was trauma and orthopedics or ENT or diagnostic imaging or whatever it was, and essentially we're in combination with the age of the patient at time of treatment, the HMRC guidance and the specialty, we're looking at whether the record can be reviewed for anonymisation or not. So cancer patients and maternity patients, the records have got to be kept for sort of 25, 30 years in terms of the retention periods advised by the NHS. And then it differs in some of the other specialties like mental health or dentistry or general practitioner records and things like that. And of course, we do have some customers offering private GP services and things like that. So that's why we've built it to follow all those different periods. So there isn't just one length of time that the system is keeping the data for. It's looking at a whole combination of settings to work out what can be considered for anonymisation and what can't.
Yeah, I'll just come in there as well, Stuart. I think there's two important things as well to understand about how Compucare is dealing with this. The first thing, when we talk about a retention period, and Stuart's explained very well how you go through and you set up that retention period in version 8. That retention period is going to do two things. One, it's going to stop anyone in the system being able to anonymise a patient who falls within that retention period. So if you go to anonymise someone and they've got a booking or some financial information that falls within that retention period, the system isn't going to allow them to do it. I think the other thing as well, though, to be aware of is the service is going to go through and find the records that are outside of that retention period, and it's going to pull those back to you. But each and every one of those records should be reviewed. It isn't something that the system's going to then automatically go through and anonymise. So you've got to go through that screen, and you've got to then actually make the decision to do that. So there still is another process that you've got to pull in there around the actual anonymisation. So we're not actually anonymising en masse. That's something that you've got to go through and review.
Okay.
I think just the final part on that really is, as much as we would want it to be, Compucare isn't the only system running in your hospital. So it may be the only one that is running your sort of master patient index of all the patient records that have been created through Compucare. But if we have interfaces out to other systems, whether they are radiology PAC systems or laboratory systems and things like that, again, the reason why we've gone down the route of showing back to you the records that should be considered is so that you can actually think about the records in those systems as well. Currently, there isn't a standard within HL7 for messaging in terms of sending out anonymisation and telling other systems to get rid of all of their data. I dare say that will come in the future as the world catches up with it, but that's why we present that list back, and then it's for you to decide what you're going to do with it, because potentially ours is not the only system that you're going to need to consider to make those reviews and changes within.
Lovely. So we've got another one in. So can we no longer charge for medical records, e.g. solicitors for medical legal patients? David, did you want to answer that one for us?
Hi, yeah. I think we might have to go and have a look at that, to be honest. I know the request for information now doesn't carry a charge. It used to carry a charge of about £10, I think. So anybody can now request a copy of all the information you hold on them, and that has to be provided within 30 days. For the specifics you've asked, we will have to go away away and check with the ICO on that, I think, and get back to you.
I think on that particular point, one of the things that we would need to consider really is that the person who owns the data is the EU resident, is the patient. So them making their request for the data, as David has said, it can no longer be charged for that sort of nominal fee of £10 or roughly whatever that was at the time under the normal Data Protection Act. I think it would be a tricky one, and we will, as David said, had to go away and have a look at what the rules would be. If you're talking about solicitors wanting to request copies of records, well, they're not the data owner, so that may be treated slightly differently, and there might have to be other consent models to be considered in all of that, which I'm sure probably happens anyway.
Lovely. Okay, so we've got another one. So if a patient has been anonymised but then uses our services again sometime later, will the system create a new account, therefore allowing two records to have the same NHS number in the background, or will the original data become viewable again? Yeah, I think Stuart's going to take this one.
Yeah, essentially, once a record has been anonymised, that's it. There is no coming back from that. It has gone through all of the previous records and deleted any notes, any attachments, and within the demographic record of the patient, completely got rid of any identifiable information. So their name, their address, their dates of birth, their NHS number identifiers, their next of kin, and things like that. So if a patient comes back to you in the future, then yes, it would be a new patient record. And you're right that Compucare does place a sort of validation restriction on whether duplicate records can exist with the same NHS number, but in this case it wouldn't be an issue because we would have got rid of the NHS number as part of the anonymisation on the first record that existed for that patient. So yes, to answer the question, it is create a new record. That's what you've got to do. We only retain the previous record as a sort of stub history, but also so that statistically and financially you can still report on the fact that there was a patient or there was that income. You just won't be able to identify who it related to.
Okay, lovely. So I think we've got a question from Kyle, which I think relates ever so slightly, but I'll read out and then I think Stuart will probably be able to answer straight back on this one. So what happens to attachments / archive reports, etc., when a patient is anonymised? One concern for us is that we scan a lot of documents to the EPR, which typically have the address graph on. I appreciate that this might be difficult, but some way of handling that sensibly might need to be looked into.
Yeah, exactly as I was saying before, we've had a look at the records that we're storing, and so anything within the patient record itself, the alerts on that patient record, the attachments on that patient record would all be removed. Going down into things like the outpatient bookings, we retain the fact that there was a booking on a date at a particular time and with which consultant, but we don't retain even the notes field within that that booking record in case the patient's name or address has been referenced. So in terms of attachments, they're gone. In terms of the patient notepads that's available as well on that banner next to the little paperclip for the attachments, all of those notes go just in case there's anything identifiable. So that scanning and all that data potentially being there, it'll all be removed as part of that anonymisation process.
Perfect, thank you very much, Stuart. So got another one. So what would happen to the Compucare number in the instance as we would end up with creating two medical charts, which consultants may require the older medical record, but we would have no way of knowing they have previously had a chart and no way of knowing the previous number? Yeah, just.
Hi, yeah. I think the answer to that is obviously we're giving you details on the patient information that can be anonymised due to the retention periods, but obviously you could keep patient record paper records as well. So in theory, you can export the list so that you can go off and destroy all paper records as well. So it doesn't, although Compucare has given you the tools to get rid of the record on Compucare, there is a whole area around your own policies and GDPR compliance that you'll have to look at all the other types of record that you use, paper records being included. So again, if you don't need to keep the paper records, then, or the computerized records, it's unlikely you need to keep the paper records as well on them. So it gives you the opportunity to go off and destroy them. So although you get a new hospital number on Compucare if they came back, obviously depending on your policies and procedures, you would probably start a new file on them as well, because all the paperwork from their previous stays and that would technically be destroyed as well from the retention periods. So it would probably be new across the board.
Okay.
I think just on that, that's another reason we should. I think that's another reason that we actually put the retention periods out where they can be changed in the system. So we're putting it out with what we see is the minimum sets from people like the HMRC and the NHS and things like that. But if you wanted to set it to say that you wanted to keep the medical records for 10 years or 15 years or something like that, you could configure that in the system so that you kept them for longer. But like David says, you know, we see that the closing down of the Compucare record is just part of the process, and actually all the paper records and things like that that you also hold on them should also be destroyed at that point. I think it's one of these sort of unintended consequences of this legislation. So whether something happens further down the line to sort of prevent this in healthcare, but yeah, it's an issue that we can foresee as well.
Okay, lovely. Just another point to follow on to that one. So how do we find the old patient number so we can pull the original chart?
Okay, part of the GDPR rules, when it comes to the right of erasure of data, you've got to retain a record stub that shows that you did actually go through and perform that data erasure. So we don't make that accessible through the main system audit log to all users. It's been restricted to only the administrators that can go in and look at that. So essentially, you will have lost all of the attachment data that we've already discussed, all the notes, all the name and all the name and address, but the audit log will keep a retention to say on this particular date, patient 56, who used to be known as John Smith, was anonymized by this user from this PC at this date and time. So if you do need to go back through, you may be able to trace it back through the audit log, but that is restricted to an administrator level only. That's not going to be available to your general bookings clerks or your outpatient super users or anything like that. Generally, it needs to, under the legislation, be kept quite restricted. Otherwise, you haven't really got rid of the data.
Yeah, just on that again, I think you know, if you're removing them on Compucare, you should be removing everything you've got of them. So if they are being removed from Compucare, those paper records should be being destroyed as well. So I think if they've been removed off Compucare, you won't have those medical charts, is my understanding of how GDPR is coming in. So whilst we're going to have an audit of that, you might have to also look at what you do around auditing the destruction of your paper records. We've certainly had to look into that around our personnel records and things like that. So I think that's something perhaps that you need to go off and talk to your boards about.
Okay, lovely. Thank you for that. If there's any more questions, feel free to keep asking. We've still got a bit more time, so there we go. Well, if anyone hasn't got any more questions, I think we'll probably leave it there. But if there is any questions that you do have, feel free to drop me an email and we can get a response sent back to you straight away. We'll send out a link of today's webinar and also the questions and some answers for you as well. So hopefully that will help. And thank you again for joining us this afternoon. Hopefully that's asked some of your questions for GDPR, but obviously, like I mentioned, if there is any other questions, do not hesitate to get back in touch with us. So lovely. Thank you very much, and I hope you have a nice weekend.